Welcome to today's press briefing. We have with us two speakers from the Center for Health Protection, Head of the Communicable Disease Branch, Dr. Chang Shuk Kwan, and from the Hospital Authority, Chief Manager, Dr. Gladys Kwan. You will hear updates from the two speakers. Good afternoon. Yesterday we had total number of positive cases, 2,672 cases, including 1,021 direct positive PCR cases, as well as verified RAT cases, 1,651. We also have 143 imported cases, of which 118 are direct PCR positive cases and 25 RAT cases that have been verified. We have accumulatively in the fifth wave 1,246,463 cases. From the Hospital Authority, we've received one death case reported. So far, we have 9,115 death cases. In the fifth wave, we have altogether 1,393 cases, including 5,343 males and 3,125 females. We'll first hear from the Hospital Authority. We have 830 patients confirmed and staying in hospitals, of which 113 patients are new cases. Those staying at isolation facilities, 313 of them are in isolation wards, 16 are in a second-tier isolation ward, 216 patients are in the North Lantau Hong Kong Infection Control Center. There are 97 new cases. Yesterday, we've received one new case in a critical condition, one in a serious condition. So far, among those admitted in hospital, we have 14 critical patients and 18 serious condition patients. And there are two patients in a critical condition staying in the ICU. I now show you a chart. In the past month, whether they are patients admitted or new cases, we see an increasing trend. I would like to show you that at the beginning of May, for the daily new cases, the number was about 70 to 80, not a low number. With the epidemic situation stabilizing at the beginning of early June, the number of new cases has dropped to about 30 to 40. You can see from this diagram that in the past few weeks, especially in the past week, we have the daily new cases standing over 100. And this is a cause for concern. And I'd like to show you this. This is the number of hospitalized cases per day. At the beginning of June, the number of admissions stays at about 400. But as I said, we have about 830 cases staying at hospitals, an increase by over 100%. The number of patients in critical and serious conditions has increased to about 30 to about a dozen or so. So we are concerned that the gravity of the epidemic situation has increased. We have made preparations for a rebound, but we ask you not to let your guard down. Those who have not been vaccinated, please do so. Also, carry regular tests. You may use our designated clinics to make appointments. If you are infected, you may be prescribed with COVID oral drugs to reduce the chance of a serious case. If we are to admit a large number of patients in our hospitals, it will create tremendous pressure to our public health care system. Our hospital services might have to be adjusted for non-essential services, say, for example, daycare checks, as well as non-essential operations might have to be suspended. So we ask you all to be careful and monitor the epidemic situation. I'd like to give you information about a death case. It's a 71-year-old female, bedridden, taken care of by families at home. She suffers from hypertension, a stroke, as well as diabetes. On the 3rd of July, because of shortness of breath, she was sent to hospital for checks at the A&E. Her chest X-ray was opaque, and the situation deteriorated. She was admitted. Her CT value was 18.1 upon admission. Her situation continued to deteriorate, and on the 5th of July, she passed away. Dr. Chuang, of the 143 imported cases, there are 118 cases that are PCR positive cases and 25 RAT positive cases. 79 cases are confirmed at the airport, and 49 are confirmed at quarantine hotels. 15 cases are picked up from the community after they have left the hotel. Most of them have got a high CT value, with a handful of them with a low CT value. We'll carry out investigation to see if they're linked to any other cases. Of the 143 imported cases, 50 were arrivals from the UK, and there are from US, Singapore, and Thailand. There are about 9 cases from each place. From Australia, 8 from Singapore, from India, 7, and there are cases from other countries. In relation to care homes, there is 1 care home for people with disabilities. Is 基督教圓洲宿舍. There are 2 cases. They are mobile, so they walk around in the care home. So there are about 60 close contacts. In relation to schools, we have 239 cases. They are from 209 schools. That include 193 students and 46 teaching staff members. Of these 239 cases, they are from 33 kindergartens, child care center, 83 primary schools, 83 secondary schools, and 4 special schools. In the past 7 days, there are 96 schools with at least 2 cases from the same school. Today, we have suggested to these schools for class suspension. There is one which is a special schools, Caritas Hospital, Locken Hohao. There are only 4 students in that class. 1 is a confirmed case. All 4 students are close contacts, so the class Ngoi Love has to be suspended. The other one is Chunjit. Lap Mau Seng Xiu Hok is a primary school in the North District. Class 4D, there are 25 students. 18 are having face-to-face classes and 7 learning via Zoom. There are 3 students from class 4D that have been confirmed. So for this class, they have to be suspended for 1 week. The other one is Ho Minghua Hui Bắc Ngan Hei Zhong Hok. Class 5A, there are 23 students. So far, there are 3 students that are confirmed, reported today from class 5A, so that class has to be suspended for 1 week. The other one is 中華基督教會燕京書院. Class 5C, there are 3 students that have been confirmed, so class suspension for 1 week. For Yinghua College, there is 1 case who is a family member of a student. So far, there are no other students that have been reported to be a confirmed case. In relation to subvariants, there is suspected BA.2.12.1, there are 19 cases, 16 of them with an unknown source. 3 are related to other cases. For suspected BA4 or 5, together with related cases, we have 22 such cases today. 10 of them are related to other cases. These 10 cases, including 2 staff members from Hotpot Foodie, there are 8 that are family members or cases from the same block of flats with previous cases. On top of that, there are 7 cases with an unknown source and their close contacts. We see that for the proportion of BA.4 is on the increase. On the 21st of June, it was 0% of local cases. Now it's close to 1%. So we can see that it has a high transmissibility. We are concerned that there may be reinfection cases, so we'll continue to monitor the situation. We ask members of the public to stay vigilant. If you feel unwell, get tested as soon as possible. When you do RAT at home, and if it is positive, you might think that is nothing. But if you do feel unwell, don't just rely on an RAT. Go to see a doctor and have a PCR done, just out on the safe side.
There are 108 patients who have recovered over the past day. 90 have been discharged since the 5th wave. 52,414 patients have recovered. 52,091 patients have been discharged since 2020. 64,794 patients have recovered, and 64,471 patients have been discharged. And the 3 patients who were picked up upon admission screening, and 4 patients are listed as close contacts, and there are 24,590 patients who have come down with COVID, and there are 21 more staff members have returned to their posts, taking the number to 24,251. And there is an announcement to make. Yesterday we announced that because of the Tonghua group, there was a male patient who was transferred from the Tonghua group Buddhist Hospital who tested COVID positive in 3 co-patients. And the infection control unit carried out the contact tracing. We found that an outsourced cleaner and 9 patients in the same ward tested positive, and all of them are in stable condition. All the positive patients have been transferred to the Tonghua Group Hospital, Wang Tai Sin Hospital, for isolation and treatment. And the ward has stopped taking on new cases and visitation. Pending disinfection and deep cleansing, the hospital will monitor the patient's conditions and liaise with the CHP continuously. We are very concerned about these clusters that are occurring in hospitals. Our infection control experts are looking to see how we can step up the admission screening and also the daily routine testing in order to identify the infections and to curb any in-hospital transmission. We remind our colleagues that because of the surge in the number of infections in the community, they have to pay attention not only to their health conditions. They should look out for symptoms if they test RAT negative, they still have to wait for the PCR test to be negative before they turn up for work. And there is a difference between RAT and PCR tests, and I hope that you will pay attention to this. It's now time for questions. Please identify the organization you represent. Lady over there, please.
I'm from Bloomberg News. My first question is for Dr. Kwan. You mentioned there's some concern over the rising hospitalizations. Can you perhaps give an indicator of at what number of new hospitalizations every day would hospitals need to possibly suspend non-emergency services? And is there any way to prevent that from happening? My other two questions is for Dr. Zheng. We've heard of recent arrivals to Hong Kong who were previously infected with COVID and they have recovered. So they came to Hong Kong with a doctor's note showing that they have recovered as well as a negative RAT test. But on arrival in Hong Kong, when they underwent the PCR test, they were tested to be positive. So they were sent to Penny's Bay as a result. So we would like to know whether it's a fair policy to require travellers who are recently recovered to undertake PCR tests if there's a chance that they may become positive and be sent to Penny's Bay. And in the case of re-positives, is there any kind of guidelines on what qualify as a re-positive case? And for re-positive cases, are they allowed to stay in their designated quarantine hotel, or will they be sent to a centralized facility like Penny's Bay? Thank you.
I'll let our hospital colleague to answer first.
Thank you for your questions. So for the trend of the hospitalization, as we just mentioned and show you on the graph, we are focused on the number of the daily confirmed cases that have been admitted to the hospital, and also we will observe the number of the critical and serious cases. Of course, the number of, as you mentioned, the indicator sometimes is quite dynamic. We'll have an overall observation of the service provision as well as the overall condition of the patients. So now we are in our central command committee for operation to discuss every day. So probably we're very cautious about the service adjustment, because apart from the COVID patients, there are patients who are not suffering with COVID, but there are urgent need for other medical services. That's why there has to be a balance to between. So we don't have a fixed number to say what service to be suspended, but we'll make a collective decision to see what is the best for the current situation.
You asked about the management of recovered patients from overseas. So if a patient, if a traveler had a history of recovered from COVID-19 in the past 3 months, that's 90 days. If he or she is tested negative at the airport, they will be transferred to the designated quarantine center. If the first PCR test has a very high CT value, suggesting of re-positive, and she or he has also a history of infection in the past 90 days, we will allow her or him to stay in the hotel to wait for the second PCR test. So if 2 consecutive PCR tests both has a high CT value, we will suspect this is a case of re-positive case, and will allow him or her to stay in the DQH until finish the quarantine. But of course, during the period of staying in the designated quarantine hotel, he or she will still have to undergo another test, PCR test at day 5. So if the day 5 PCR test becomes lower, for example, a very low CT value with a decreasing trend, this may suggestive of a reinfection. We may have to isolate him or he or she. But if the test is still negative or very high CT value, he will be regarded as a re-positive case. We will judge it case by case, usually more than 30 or so.
下一題，前邊嗰位。
Next question, the one at the front. I'm from Now TV. First of all, I'd like to ask about Yinghua College. Have you identified the transmission chain yet? Did it involve any large-scale activities or activities without masks on? The Yinghua College as well as other schools, there are about 20 people that have been infected, but only one class has seen suspension. So what is the criteria for suspension? Why not suspend all classes involved? What are the considerations? Previously, the chief executives talked about considering shortening the quarantine period. In terms of epidemiology, what is the shortest but safest quarantine period? What is the minimum number of quarantine days? For Yinghua College, there are 4 classes, not 1. And each class, there are 3 to 5 students that have been infected. We have not identified any new cases of students apart from a family member of a known case. For the 4 classes, we've asked some questions. We found that some students might have sat close to one another during mealtime. That might be one of the reasons. So we've asked the school to pay attention to the meal arrangements. For your other questions, well, we will have to continue with our investigations. The reporter behind. I'm from cable TV. I'd like to ask about Yinghua College. You talk about students staying in close proximity during mealtime. How many of them are there? How many students ate outside the school and how many ate inside the school? You talk about an in-hospital infection in Wong Tai Sin Hospital. Have you identified the transmission source? Have you made any assessment of the capacity of hospital authority? You just now talk about your capacity with over 100 people being admitted per day. At what level would you be unable to handle it? At what level would you have to suspend certain services? I was referring to mealtime when students ate at their canteen. But some students might have gone out to eat, and there might be other people sitting nearby. You mentioned about the patient at Wong Tai Sin Hospital. That patient at one point was at the Hong Kong Buddhist Hospital. We are now carrying out investigation to find the source of infection. We closely monitor the hospital clusters. We're still looking into how to enhance admission screening as well as arrangements in relation to our staff members. You'll be updated when we have new information. We gave you information about the number of cases that we have observed in the past month. At the moment, we are still able to handle it. But still, we are concerned that if the rate of increase is high, it will put pressure on the public healthcare system. However, there is no rigid fixed indicator to for our suspension of certain services. There are some patients that are not COVID patients, but they still have medical needs. We do need to strike a balance. Every day at our headquarters, we monitor the situation of hospitals in the 7 hospital clusters. We would take into account how we are able to take care of patients' needs. There is no rigid indicator, but there might be minor adjustments in hospital services of certain clusters, say for example daycare checkup. We might make adjustments. Sorry, speakers off mic. The interpreter cannot hear. We need to keep observing the situation. Because of the typhoon, there was a suspension of service for a day or two of these community testing centers. So some people might receive their reports a day or two late. So we'll need a bit more time to see how that has impacted the situation. I'm from Mingpao. I'd like to ask about BA4 and BA5 cases. So how many cases are there that carry the subvariant BA4 or BA5 in Hong Kong? And you mentioned about risk of reinfection. How many such cases are there? Can you give us more details? Given the higher transmissibility of BA4 or 5 and there is a chance of reinfection, what's your assessment of this in its impact on the overall epidemic situation? What are your strategies to handle the situation? Compared to overseas situations, we see that the rate of increase of these two subvariant cases are not as fast as overseas countries. Is it because of the herd immunity we have or other reasons? And what is the percentage of serious cases of BA4, 5 compared to other subvariants? There has been appeals to citizens in other places to wear KN95 when they go out. Would you make a similar appeal in Hong Kong to try to control the COVID situation? In our press releases, we list out the number of cases of BA4, BA5 or suspected BA4, 5 or suspected BA.2, 12.1. So far we have 7 and 9 cases of BA.2, 12.1 and 495 cases of BA4 or 5 suspected cases. And high number of cases are imported cases. For local suspected BA.2, 12.1 or with L452Q, there are about 505 local cases. For BA4 or 5 or BA452R, there are about 106 cases. But that excludes today's cases. In terms of increase, we've just identified local cases. It's difficult to tell whether the trend will follow that of overseas places. In the past day or two, we see quite a number of such cases, and most of them are with an unknown source. That means there is a transmission chain in the community. It's a matter of whether we can identify them. We carry out the L452R analysis for these cases. So of known cases, we know the rate of the percentage is currently about 1%. We will keep in view the situation. And as to whether we will follow overseas trends, it's difficult to tell. It's difficult to find a place that is comparable to Hong Kong. In relation to serious cases or otherwise, currently we don't have a high number of these cases, but there is no marked difference from BA.2. Regarding KN95, we advise people to wear fitting masks. One of the good choice is those 3D masks, or to wear 2 masks that will give you a better fit. For reinfection cases, there are about 3 cases of BA.2.12.1 from full-Thai nursing home. And we've also identified 1 case from the hotpot foodie cluster. But for the previous round, we did not carry out the sequencing, but now we see that most of them are subvariants.
Gentleman over there, AM 730. Dr. Chong, you said at the outset that there is an increase in BA4. Are you talking about BA4 and BA5? We have more imported cases now for the 2 community quarantine hotels. Do you think they can meet the demand? The imported cases, do we see any difference in terms of the places of origin? We have more people being hospitalized. Do we have the range of age? What sort of ages are they in the majority? And what sort of cluster do they come from? And you said that the services might be adjusted. Will you be working in accordance with the contingency plan in making adjustment? Before suspending the non-emergency services, what measures will you adopt before you suspend the service? In terms of proportion, BA.2, 0.12, 0.1, it is 1 to 1.6 or 7%. That's more stable for the time being. For BA.4, BA.5 cases, previously it was 0% to 0.8% or 1% currently. So these are 2 separate figures. Taken together, it is about 2%. I understand that the relevant department would pay attention to the sufficiency or otherwise of the quarantine hotels. They will be looking at the utilization. Now, for the imported cases, I've received some inquiries, so I gave more information today. You mentioned the hospitalized patients. I don't have the age range with American Supplement later on. As to the reason for hospitalization, they vary. Some come down with COVID. Some are hospitalized due to their own personal problems, and they tested positive. Speaker not coming through. I'm not with you, sorry. The speaker not speaking through. Right, let me put it this way. Our approach is that we are making the preparation. We are making preparation for the beds, the manpower, the hardware, and so on. So all the preparatory work is going on in tandem. Of course, we will monitor the development of the pandemic. If the number of positive cases increase that need hospitalization, then all these preparatory work will come in handy. So the adjustment of the services will depend on the situation. Let's pick the last question, lady over there, please. Economic Times, about the Yinghua College. There are more than one close contact. Are they from the same school or same class? Have we got the genome sequencing results? Now, you said that they would have lunch together. Do they have lunch across different classes, or do they have lunch in the same class? Now, we have seen a surge in the number of hospitalization. Does the CHP see the need for tightening the measures? Now, you said that we shouldn't just rely on the RAT test, we should go for PCR test. Now, for the RAT positive cases, do you turn up for the PCR test for confirmation? And do people have to wait for the PCR confirmation, or do people have to go to the testing station for the PCR test? Now, for the drug from the mainland, the paracetamol from the mainland, how many doses of paracetamol have you procured from the mainland? Are you going to be procuring more medication that is not registered? In terms of the Yinghua College, the student is actually from class 1C. That's a family member of another student. I talked about lunch they would have lunch with their classmates. Some would have lunch with classmates from other classes. So there are confirmed cases from various classes. If someone has undergone RAT and tested positive, they should make the declaration online. They should make available all the information. They should also wait for confirmation. They should stay at home if they are RAT positive. Some may feel unwell and they test RAT negative and they figure that they may be okay and they turn up for work, they turn up for school and other things. And the RAT does come with some limitations, and the CT value at the beginning of the illness may have high CT value, 30 or something. The RAT may not pick up this if it is 30 or so in terms of RAT, in terms of CT value. If they feel unwell, they should stop going to work or to school. If they're feeling unwell, they should go see medical attention. They should feel as if they're okay. They should conduct more RAT tests, but the best course of action is to have a PCR test. Speaker not speaking through. I think this has to be looked at as a whole. We have to look at a whole host of factors. On the mainland medication, I don't have the number with me as to the precise quantities. In terms of the medicine safety and quality, that's of paramount importance. Of course, we will have regard to the supply, the logistics, and procure medication that is commensurate with the DH requirement and make them available to the hospitals and clinics. If the medicines experience some supply disruption, and in some cases we saw some supply disruption, and we have to import or procure medicine from other sources in order to make sure that the patients will get the suitable treatment. So it's only with the permission of the government that we will import the medication. Our pharmacy will make available the information to the frontline staff and also the patients to make sure that the medicine will be used appropriately. I don't have the number with me. That's it for the press conference. Thank you all very much.